Okay, there's people still logging in, but we might get started so that we can keep to our schedule. So welcome everyone here today. We're really excited to be able to bring this webinar to you. Thank you all for your patience as we rescheduled this session from early June to now. I'll get started with a few housekeeping points first. So we're recording this session and it will be available on our website to view afterwards if you have to leave early. And we're also using the webinar function in Zoom, which means we can't see all your friendly faces as attendees, but we can hopefully deliver this webinar without any technical issues. So please pop any questions you have for our panelists in the Q&A section at the bottom of your screens. So you can choose to share your question with the panelists or to the panelists and all other attendees, so people can see your question and they can upvote your questions as well. And if you have any comments or want to share links, you can do that in the chat function as well. So everyone, I'm Ruth Oliver, so I'm a Sustainability Coordinator at Monash University. And by my side virtually, I have Natasha and Shirley who will be assisting me today so that things run smoothly. So we can get through as many questions as possible. So this webinar today is Monash's contribution to the Acts of Connection series of events, which is organised by ACTS. ACTS is the Australasian Campuses Towards Sustainability organisation, and Monash is a member of it. And all the events in the series are available to current staff and students at a number of universities across Australasia, including Monash. And people can learn more about the Acts of Connection on the ACTS website, and we'll share that link for you in the chat. So I'd now like to do an acknowledgement of country. I prepared this acknowledgement when this event was scheduled to run during National Reconciliation Week, which is every year from the 27th to 3rd of June. The dates, the 27th of May and the 3rd of June, commemorate two significant milestones in the reconciliation journey: the successful 1967 referendum and the High Court Mabo decision, respectively. So even though National Reconciliation Week has finished, I thought I would still share the acknowledgement of country I prepared, as I think it links closely with today's introduction to planetary health. So the theme this year for National Reconciliation Week was "More than a word, reconciliation takes action." So I'll admit that I'm a well-intentioned but still ignorant ally of Indigenous people, and I would like to do more to heal the wounds of past errors. So as we've gathered today together in a physical dispersed manner on this virtual Zoom platform, let us take a moment to reflect on the meaning of place and recognise the various traditional lands on which we live, work and play. So I acknowledge the elders past and present of all the lands we are today, and feel free to mention the lands on which you are today in the chat. My home is on the land between two traditional owners of the Kulin nations, those being the Wurundjeri people and the Bunurong people. So while the concept of planetary health is new to most of us, for many Indigenous peoples, it is the foundation of who they are. So Clinton Schultz, who is a Gamilaroi man from northeast New South Wales, says his people clearly understand the detrimental interference with anything within the natural world impacts back on our individual and community wellbeing. So when our wellbeing is impacted in a negative way, this in turn plays on our ability to maintain process of caring for country. And so this takes me back to why we decided to create this webinar. When we introduced health and wellbeing to our Green Impact program at Monash University, we were asked why. Why are you including health and wellbeing with sustainability? And it's a reasonable question. As both sustainability and health and wellbeing, they're broad concepts encompassing a wide range of issues, but both are linked to socio-economic processes that shape our society. The impact of climate change on the health of communities is growing, and we believe this is why it is important to introduce the research into this area called planetary health. So the research can then feed into public policy and practice. Working at a university allows us the privilege of bringing these emerging areas of research to you in a relatable manner, and we hope you enjoy today's webinar. So we have two speakers today. I'll just slide. Sorry. I'm trying to get on to my next slide. Okay, can't do that. So we have two speakers today, both Monash University academics. We will allow both speakers to talk before we open up to questions from the audience. Our first speaker is Selina Lowe. Dr. Selina Lowe is a Senior Research Fellow at Monash Sustainable Development Institute. Selina is a medical graduate from the University of Melbourne in 1993 with a postgraduate degree in Public and International Law focusing on trade, human rights and health. Selina has previously worked for Doctors Without Borders, leading medical humanitarian project teams in Kabul, Afghanistan, Rakhine State, Myanmar, Bangladesh, China and Thailand. She was the medical director for Campaign for Access to Essential Medicines based in Geneva and clinical advisor to the Clinton Foundation based at the National Chinese Centre for Disease Control HIV/AIDS unit. Selina was also the inaugural executive officer for Doctors for the Environment Australia. Selina is a consulting editor to The Lancet. Prior to this, she was The Lancet's senior editor based in Beijing and London, responsible for global and planetary health commissions. She holds honorary affiliations at the University of Melbourne's School of Population and Global Health and the United Nations University Institute of Global Health, Malaysia. She is a patron of the board of Global Ideas and sits on the steering committee of social and entrepreneurship to spur health, building capacity to crowdsource financing for lower income country researchers in infectious disease. Selina, I'll hand over to you now.
Thank you very much, Ruth. I'm just trying to share my screen. Oh, here we go. So thank you to Ruth for that very eloquent and relevant welcome. I also wish to acknowledge the traditional custodians on the land upon which we meet and pay my respects to the Wurundjeri people of the Kulin Nation and their elders past, present and future. I also want to acknowledge First Nations people everywhere globally and their role and intrinsic history in planetary health. So the title of my talk is What is Planetary Health and why bother now, especially when we're in the middle of a global pandemic? I'm going to start with a very personal history of why I came into planetary health. As you've heard from the introduction, my background is not as an environmentalist at all. It's coming from medicine and human rights law. But I was living in Beijing 6 years ago with my young family and at the zenith of air pollution in China, really, before action was taken very constructively and decisively by the government. This, for those of you who know it, is an air quality monitor, and WHO has levels they recommend of less than 10. This was indoors on Christmas Eve one year and it was 225. And we kind of got used to that, or tried to get used to it living there. But this next photo is of children, one of them, which is mine, outside the Natural History Museum in Beijing. And I find it quite poignant, but also I like to play the game of spot the species that is extinct or soon to be extinct. You've got dinosaur skeletons in the background. My daughter's holding a snow leopard soft toy, extinct. But really, it's the question of our species, which is really impacted by the quality of the environment, the air we breathe, and the water which we drink. And so all this period that I was living in China for those years, I started working on a project as a commissioning editor for The Lancet called Planetary Health. And when the editor-in-chief, Richard Horton, first brought this to us at the editorial board, a number of us laughed, both at the title of it and the idea. And for myself, I couldn't understand why, would we as a global health community be thinking about such a broad enterprise? We had just put aside the Millennium Development Goals. Many of them were unfinished. We had huge burden of non-communicable disease and obesity and to look at and to overcome as a global health community, why would we look at the generations to come? But I have to have him to thank, because the combination of living in China at that time and working on this truly aspirational but very timely project and thematic really changed the trajectory of my own career and intellectual interest. The report, which was published in 2015, was prefaced by this quote by Wendell Berry. "We have lived our lives by the assumption that what was good for us would be good for the world. We've been wrong. We must change our lives so that it will be possible to live by the contrary assumption that what is good for the world will be good for us. And that requires that we make the effort to know the world and learn what is good for it." Many not so much criticize, but question the authority and the role of a medical journal to publish on such a broad enterprise. But in fact, if you look through medical history, Hippocrates had hundreds of years ago already written on airs, waters, and places, and put human health and humans in our place in nature, both for our well-being and future health. So what is planetary health? In terms of definition, I think this is the simplest definition and it encompasses all. Put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. And note, it doesn't only say health of humans, it's human civilization. The whole point of planetary health as a field and as a movement is that we learn to organize ourselves in ways that can allow flourishing of the natural systems and of our own well-being and health. I thank Professor Tony Capon for this slide, the director of the Monash Sustainable Development Unit. Planetary health is a cultural transformation. It's about safeguarding the health and well-being of current and future generations through good stewardship of the Earth's natural systems, and by rethinking the way we feed, move, house, power, and care for the world. And I would add, and for us, ourselves individually. So how we manage ourselves to leave no one behind is really probably the crux, of what global health has always been about. By almost any measure, the human population, in terms of our measurable human indices, is healthier than ever before. Life expectancy has increased in the last 50 years, mainly due to improved child survival and better control of infectious diseases, but also better services for health and maternal health. But to achieve this, we've exploited the planet at an unprecedented rate, to the point that geologists are now defining our epoch as the Anthropocene, where from very far away from the Earth, from satellite, we could see the impact of human activities on the actual substrate of the Earth and the changes. So ocean acidification, energy use, global deforestation, water use, and atmospheric concentration of CO2, all trending in the wrong way in the last 50 years. Will Stefan and Johan Rockström defined multiple planetary boundaries that have been breached. And increasingly, we are understanding the escalation of human pressure on the global environment. So we're actually able to measure many of the health outcomes and health effects. And Professor Guo Yuming will speak about this in the next discussion. So examples of health effects include direct health effects, such as floods, heat waves, water shortages, ecosystem-mediated health effects, such as altered infectious disease risks, reduced food yields, but also the indirect and displaced health effects, such as population displacement, conflict, and inappropriate adaptation and mitigation strategies. Climate change, land degradation and soil erosion, water scarcity, loss of pollinators, and overfishing and ocean acidification change our food availability and quality. Of course, we can also point to the companies that produce massive processed foods for consumption and marketing of that, but the actual natural products that we normally consume and farm, they're also being depleted at such a great rate that it's alarming. Perhaps it is in the terms of the estimates of air pollution deaths where health outcomes are most telling. And I think for any of us who've lived some months or years in very polluted cities, your life really cannot be the same. The impact on our mental health after 5 days of really high air pollution, whether you're inside with expensive air purifiers or outside in the open, is a memory I will never forget. And I know those of you who lived through the summer of bushfires 2 years ago will understand this now. 91% of the global pollution live in places where air quality exceeds WHO limits. And I'm not sure you can see this, I'll just move my picture. Air pollution was responsible in 2015 for nearly 7 million deaths worldwide. Increasing emerging diseases in terms of the differential in temperature, such as dengue. Dengue fever has risen in many parts of the world and cities that we didn't see it, or places we didn't see it. And although the causation and the links with the COVID-19 virus have not been definitively defined yet, we can say, because of globalization and rapid air travel, that definitely contributed to the rapid early transmission across the globe. So the report and the Commission asked us to meet the challenges by addressing specific gaps in our knowledge, in the way we govern ourselves and our systems, but also to use our imagination, which is a very human enterprise, or at least what we understand as human enterprise, because we don't understand everything about other species, animal or plant. So one example is something that many people at MSDI and Monash University themselves are credited for, which is the development of sustainable and healthy cities, active transport, green spaces, access to healthy food. All these things not only are good for the environment, but have co-benefits to our health. So by being more physically active, we can have better reduced risk of cardiovascular and respiratory diseases. And then innovative approaches for meeting increased food requirements include sustainable aquaculture, new sources of nutrition, and also support for subsistence farmers. And I know this was covered previously in another talk, but more recently, the Planetary Health Diet was published by The Lancet with the EAT Foundation, where experts came together to look at what was the best diet really for the planet, but also for our human nutrition. And they call it a flexitarian plant-based diet, where you don't omit meat, but you're careful and limited in what proteins you choose. The rest of my discussion will be focused on COVID-19 pandemic in the Anthropocene. And I asked the question, why a pandemic is the greatest and possibly the only opportunity for practicing and realizing planetary health in our generation. COVID-19 and climate science have a lot in common, actually. They're both complex science to be communicated. They require global intersectoral collaboration of systems. And it requires new ways of thinking and individual and political leadership to survive. But perhaps the difference in it is in terms of the action of urgency. COVID-19 produces deaths, unfortunately, and systems overload. We're not seeing that necessarily with climate change. And that is potentially why some commentators have said why we haven't acted with the kind of urgency that COVID-19 has produced. So how we manage ourselves to leave no one behind is, in fact, the key to global health in terms of it being health for all and not just some of us. I'm going to show an example of access to medicines that I think is maybe not seemingly a planetary health issue, but certainly in terms of how we act together to solve a problem, it is a planetary health thematic. So this is a poster from the 1999 Access to Medicines campaign when we were lobbying for the antiretrovirals for HIV treatments to be cheaper. And they said medicines shouldn't be a luxury. Flash to now. We estimate that many poor countries will not be able to reach vaccination rate suitable for their populations until 2023, 2024 or later. Yet, Jonas Salk, who was one of the first inventors of the polio vaccine, didn't want it patented. He actually wanted the vaccine to be used for future generations, for future good. He was truly a planetary health physician, and he asked that pertinent question, are we being good ancestors? So my background is in global health. That is the framing that I understand best. And so I apologize to those of you from, other sectors if this is a little bit jargon-like, but I propose that many global health challenges, the sticky ones that we haven't been so good at answering in the same way we have in terms of making randomized control trials and new vaccines and commodities, that our sticky challenges are really all about these determinants of health, the political determinants, the social determinants, and increasingly, what you can't see because my picture is blocking it, the commercial determinants of health. But planetary health platforms and solutions could perhaps provide some of the answers. So what are the key principles of planetary health? I'm going to talk about the two key ones, and they are, so addressing the gap in knowledge, transdisciplinary research. This is more than us doing interdisciplinary projects together. It's truly about transcending the silos with a planetary health objective, creating new generations of researchers and leaders, and importantly, the use of mindful disruption of our sticky systems that we've created ourselves and the cultures for planetary health. In terms of governance, intergenerational justice is really important. And later I'll talk a little bit about some legislation that's come about. But I actually point to a very recent decision and precedented global, has received a lot of global attention, of Justice Bromberg in our federal court in Sharma versus the Minister for the Environment, where he said that the current inaction of adults on climate might fairly be described as the greatest intergenerational injustice ever inflicted by one generation on the next. And although this wasn't set out as a principle, I think, Ruth, you eloquently described the importance of Indigenous wisdom and its inextricable link to planetary health. And I propose the question that are we as institutions, medical journals, government, NGOs, all of us practicing planetary health or wanting to be interested in it, are we immediately embedding Indigenous knowledge and wisdom in our governance framing? In terms of the SDGs in our current context, there are multiple thematics which, although when you look at it, you cannot necessarily see the direct role with nature, the platforms of a good planet and planetary health do provide, and the idea of a healthy human civilization do provide some of the necessary platforms and perhaps networks to answer some of these very, very important themes. I looked through Monash, what I would think were Monash planetary health projects, and this is just my list. And I'm sure those of you directly working on issues that are transdisciplinary and involve intergenerational equity could say more. But just to point at some of our interesting projects, such as RISE project at MSDI, some of our law interests, the Net Zero Monash infrastructure projects, our actual draft strategy, which has climate change, healthy communities and geopolitical change at its heart, the Planetary Health Centre coming up, the Sustainable Healthcare Micro-Credential, and also even the Union is asking for fossil fuel divestment campaigns from our super. And then there's the others that are not so easily defined, but I think have got a lot of potential in terms of business in the future, for example, in the media. There are multiple national and global opportunities. These are only just some, but to point to the Wellbeing of Future Generations Act in Wales, it's unprecedented and it is a planetary health piece of legislation. The Planetary Health Governance Frameworks of New South Wales, the new planetary health departments popping up and centres popping up all around the world. And then the academic community, okay, particularly the global health community right now, are supported with financing to do transdisciplinary research, and our new communities of business investors. So lastly, I ask, do we dare to flourish? The fact is, the planet's going to survive with or without our species. Whatever we do, whether we're wiped out by a virus, another pandemic, or whether we just disorganize and cannot organize ourselves enough to address the climate change, the planet is going to survive. But what do we need to do to allow us to survive on it? We need the planet for our food, air, water. We also need it for our mental health. And we also need it potentially for future and current treatments. We need to protect our biodiversity. This is the Qinghaosu plant. It was the precursor of artemisinin, which revolutionized malaria treatment 2 decades ago. So nature does hold the answer. We just don't always know it yet. But we also need those things for human flourishing that involve the way that we organize ourselves, social connection, cohesive societies, the cultural arts. The defunding of the arts is by so many governments around the world during the pandemic, and understanding the mental health burden of our societies during the pandemic is wrong. Our universities and human rights, and also this cherished circle of life continuum from birth to aging. So how we move, feed, house, and power ourselves is really important. But I would say if we had to choose one for right now, how we care for ourselves and others is really important. The real test is valuing our own humanity, our human humanity, what makes our species different, and what we need to flourish with the planet, and make this planetary health flourishing the legacy for future generations. We need metrics, new metrics, we need funds, we need to be active, not just physically active for our health and well-being, but also activists in terms of every area that we're working in. And lastly, although it sounds trite, but kindness and tolerance is, it's simply, there's no substitute for it. I thank the organisers for this talk, because the reason we had to postpone is because my mother was having bypass surgery the day of the last talk. And their kindness and still promoting me to be one of the speakers is why we had to come here today. And so I finally leave you with one of my favourite writers, who was an environmentalist, and this is a very old slide, so it's why the title wasn't changed. But Edward Said talked about barely surviving groups, exclusion and invisibility, an overexploited environment, and people marginalised inside as well as outside the more of the metropolitan centre. So when we're looking at global health, we're living in a pandemic, and we're talking about in future generations and planetary health. I think one of the important things for why we bother, or at least why I bother, is this. It's the importance of thinking about those that are excluded. And the COVID pandemic has certainly brought that up to fore, and planetary health is part of the answer. So thank you from my part of Melbourne, which is the Yarra Bend, and to the people who inspire all of the thoughts in this presentation and my work in planetary health. Thank you very much for listening.
That was fantastic. Thank you so much, Selina. It was a great introduction to that, and I particularly liked you sort of expanding the picture of what humans need to thrive and flourish with the planet. So thank you. So if I can ask people to pop their questions for Selina into the Q&A section, and we will get to those questions after we have our next speaker. Sorry, I will share my slides. I've figured out how to work it again. Okay. So we've had Selina talk, and now we'll have Professor Yumingo talk. Okay, so Professor Yumingo is a Professor of Global Environmental Health and Biostatistics and head of the Monash Climate Air Quality Research Unit. Yuming is supported by the NHMRC Career Development Fellowship. He was awarded a Master of Medicine in 2009 and PhD in 2012 from Peking University and Queensland University of Technology, respectively. Before moving to Monash University in March 2017, he held appointments at the University of Queensland, Queensland University of Technology, and Peking University. His research group focuses on environmental epidemiology, biostatistics, global environmental change, air pollution, climate change, urban design, residential environment, remote sensing modelling, and infectious disease modelling. Yuming, welcome, and please share your presentation with us.
Thank you, Ruth.
Thank you.
Can you say it?
Yes, we can. Perfect.
Okay. Yeah. At the very beginning, I would like to show my respect and acknowledge acknowledge the Aboriginal people and the Torres Strait Islanders, who are the traditional custodians of the land of elders, past and the present, on which this meeting takes place. Thank you, Ruth, for introducing me, and thanks for the Monash University to organize this meeting to discuss the problem of climate change, fate, bushfire, and human health. I think everyone is already know climate change is the biggest global health threat in the 21st century. This has been highlighted by many reports. For example, the Lancet Commission report, the UN report, and WHO report. This is happening everywhere. The main pathway between the climate change and human health, about 7 to 8 pathways, but the most important two are heat and air pollutants. And also this is the focus of one team working. So I will focus these two items for heat and air pollutants to introduce their health impact. The first part is the health effect of ambient temperature, including heat waves. The main performance of climate change is the temperature increase, and the temperature increase has already been happened from 1880s to now, and it will be continue to increase. And this increase of temperature is not only happening in one area or one city. This is happening around the world, across the world. That is happening everywhere in the world. So this is a serious problem. So we need to define what is the impact of the temperature on human health. So based on this question, our group has done some global study to look at the relationship between temperature and mortality or morbidity. The first global study, this is the largest one, including 12 countries across the world. And we can say from this figure, the x-axis is the percentile of temperature, and the y-axis is the relative risk of mortality. We can say for both cold temperature and high temperature, increase the mortality risk in all the countries that is included in this study. But there is one interesting finding, that is the comfortable temperature are similar in all the countries. That is the minimum mortality temperature is located in the 75 percentile of temperature. That means the people have ability to adapt to the local temperatures, even though the cold temperature and the hot temperature can increase the mortality risk. But if people stay somewhere for a long time, the comfortable temperature can be changed and can be adapted. So based on this finding, we calculated how many deaths can be attributable to the cold temperature and hot temperature in these countries. And the main finding is the cold temperature is the main risk factor for mortality, and it is higher than hot temperature. And for the international level, about 7% of deaths can be attributable to cold temperature, but just 0.5% attributable to hot temperature. So that means, in the context of climate change, even the hot temperature is very important and it's dangerous for human health. But we can't ignore the impact of cold temperatures, because it is causing a large fraction of mortality. And also, in the last year, the GBD group, that is the Global Burden of Disease Study Group, included the cold temperature and the hot temperature into their report. And then based on this report, and also I am also an investigator in this report, and the results shows for the non-optimal temperatures, that is including cold temperature and hot temperature, for female, it is ranked 10th for the global burden of disease, for the mortality burden. But for females, that is that is ranked 11th across the world. But because this studies only focus the data from the 8 countries, so there is an underestimation. Currently, we have undertaken another study that is using our international network, that is about 43 countries data. And based on the 43 countries baseline data, we calculated the mortality burden due to cold and hot temperature. And actually, it's much higher than this estimate. It is about 5 million deaths can be attributable to cold and hot temperatures. And it is just following air pollution for both female and males. And that paper will be published in July 7th at Lancet Planetary Health. So if you are interested, you can read that after the publication. And here, we are also interested in if people have adapted to the high temperature from the last century to now. We collected time series data from several countries across the world and compared their trend for the heat impact on mortality. Here, that is for the x-axis, that is some temperature, and for the y-axis, that is relative risk for mortality. For the green color, for the blue color, that is the mortality risk of temperature in 2006. But for the black color, that is mortality risk in 1993. We can see in Australia, the mortality risk for high temperature did not change between 1993 to 2006. But if we look at US, Japan, and Spain, we can see the heat impact on mortality have been reduced in these 3 countries. That means Australia still need to put more effort to mitigate the heat impact on human health, following the policies or following the strategies by US, Japan, and Spain. And also, we are interested in which population are more affected by heat wave or high temperature. So, because we have a lot of data from Brazil, we divided this population, the national population, into different age groups and gender group. We can see for the man or woman, there is no difference for the heat wave impact on mortality. But for the age groups, we can say the elderly and the children are more sensitive to heat wave than the adult. And also, we need to understand which area is more affected by heat or cold. So we used a unique data set from China, that is from Zhejiang province. It has a large population. We divided the population into rural area and urban area. We can see for the rural area, both cold temperature and hot temperature had higher impact on mortality than urban population. So that means more effort should be put to the urban area to prevent the health risk from temperatures. And this result is a little bit different with Western countries, for example, Europe and the US, because they found the temperature effect, particularly for the hot temperature effect, they are higher in urban area than rural area. So we need to, we need to be careful to put different policies in different areas, in different countries in this area. So there are also many urgent issues and questions and knowledge gaps in this area for the heat wave impact or temperature effect. Even though we know cold temperature or hot temperature can increase risk of human health, but there are still a lot of issues. For example, have people adapted to health risk associated with heat waves or cold spells, because the temperature is changing, and also different countries have to take different policies to mitigate the climate effect. And also which factors determine the demonstrated spatial temporal difference in the health impact of heat waves or cold spells, and which populations are most susceptible to heat waves. For example, which age group, which sex, and which socioeconomic disadvantage and pre-existing illness, and also which communities or areas are most impacted by heat waves. So we need to know all this before we want to make a precision mitigation or adaptation policies. For this part, we will look at the health effect of bushfire or wildfire smoke, or bushfire or wildfire themselves. So we know, because we're living in Australia, or even some people living in US or Brazil, we have faced a serious problem of bushfire smoke in the last several years. And particularly, the bushfire smoke is not only limited to the area for bushfire, but also it can be transmitted to the other areas. For example, in the 2019 and to 2020 bushfire smoke in Australia, it has been transferred to South America. So that is a serious problem. That means the bushfire smoke not only affects human health in the fireplace, but also affects human health for the people living far away from the area, the fire area. The last year, we performed a literature review to look at the relationship between bushfire, wildfire under the global climate change, and the relationship between human health. So we can see the climate change can increase the frequency and the density of wildfires, and the wildfires, reversely can increase the risk of human health, and also it can increase the greenhouse gas emission, and it is related to climate change. So if we don't take any action to mitigate climate change, there will be a reinforcing feedback loop of climate change, wildfires, and health risk. And also there is a projection for the wildfire density and frequency in the future. We can say if there is no action or just limited action for climate change, the wildfire frequency and density will be increased a lot in the future. That is shown in the right figure on the different climate scenarios. The climate scenario RCP 8.5, that is the serious scenario. That means we don't take any action for the climate change. And also, it has been understandable. So air pollution can increase the risk of mortality and morbidity. And also we conducted a global study that is including 652 cities across more than 30 countries. And we analyze if there is a threshold between air pollution and mortality. So because if we get the threshold, or we get a safe level of air pollution, so we can define the air quality standard. But unfortunately, from our results, we can see there is no threshold between air pollution and mortality. And particularly, this is the day-to-day variation of air pollution and mortality. That is the short-term effect. If you look at the long-term effect of air pollution, that is about the annual mean of air pollution exposure and annual mortality rate. So we conducted a study in Queensland. This results is shown in the right figure. We can see for cardiovascular mortality, non-accidental mortality, respiratory mortality, and all-cause mortality. There is there is a potential threshold for the long-term exposure of air pollution, that is about 4.5 microgram per cubic meter, or PM 2.5. But above this threshold, there is an increased risk of all these mortality types in Queensland. So that means, if we only look at Queensland, that might be a threshold effect. So this should be considered by the local government to develop the air quality standard. And also regarding the impact of bushfire smoke or bushfire on human health, currently there are still limited evidence, even though there are some studies have looked at the short-term effect of bushfire smoke or bushfire PM2.5 on mortality and morbidity in some areas, but it is still far limited. So because the bushfire smoke data is very limited, it is not easy to be modeled. So we conducted a global bushfire smoke project to model the global bushfire smoke across the world. So this is the results for the modeled bushfire smoke between 2000 to 2016, and we are continuing to modeling the bushfire smoke concentration from 2017 to 2020. And currently, it is nearly done, and we will match this data to the human health data to look at the impact of human health. So if we only look at the data from 2000 to 2016, we can say the Russia and Victoria of Australia, and also the middle of Africa and Brazil, northwest Brazil and Canada are most affected by bushfire smoke across the world, and the West US. And then we use the available data to link to our global study project, that is 749 cities mortality data from 2000 to 2016. And we performed the time series analysis to look at the short-term effect for bushfire smoke, particularly for PM2.5 and the mortality risk. And this is our finding. That is, you can look at the right figure. For the total mortality, cardiovascular mortality, and the respiratory mortality, for the bushfire smoke, it has the risk for mortality across the world. And the bushfire smoke effect is lasting for 2 days from exposure. For example, today there is bushfire smoke. It will have higher risk for the mortality, and this risk will last for the next 2 days. Okay, here is there are also some urgent issues and questions in this area. For example, what are the health impacts of a prolonged exposure to wildfire-related smoke? Because at this moment, there is only one study looking at the long-term impact of bushfire smoke, that is conducted in Indonesia. They only look at the children's lung function change, and also which populations are most susceptible to the wildfire-associated smoke. For example, age group, sex group, and different socio-economic and the pre-existing illness. And also other health impacts from bushfire-related air pollution and urban background air pollution different, because currently there is no comparison between the urban background air pollution and the wildfire air pollution, because they have different resources and they have different characteristics, so their impacts will be different. And the health series is a global burden of disease attributable to wildfire or bushfire air pollution. Currently, there's only one study looking at the mortality burden attributable to bushfire smoke. That is just conducted in 2014. That is very old, and recently the bushfire is more frequent and more serious. We need to renew that results. And also, I would like to acknowledge my teams and the collaborators and the founders. My team, my collaborators in Australia, and my international collaborators for the multi-country collaborative network, and for HMRC, ARC, and the Monash University. Okay, thank you very much.
Fantastic. Thank you, Yuming. That was a very excellent presentation. Yeah, talking a lot about the fire, smoke in that, it sort of takes me back to pre-COVID days when we had those bushfires, and we thought that was going to be the most devastating thing of 2020, but it wasn't, unfortunately. I'll get Selina to bring her camera back on now, and we'll move to the question and answer part of the webinar. We've only got a couple minutes left, but we do have some questions that we can ask. So the first question is, what are some specific ways that we can help the overall health of our planet? How can we raise awareness for planetary health? I'll open that up to either of you.
Do you want me to start?
Sure, thanks, Selina.
So, well, the obvious first answer is individual actions, and I think whoever's asking more than me will know what individual actions are possible for you. My answer to this is usually do something. I mean, whether it's food, the energy use, the housing, or your reduction of air transport, etc. It's to do something in terms of individual action and commit to that for the year and keep learning. In terms of raising awareness and going beyond, being more active, what I said in my presentation, I think this is really important. It's really not so much what I can do, what you can do, but like what we can do together and collectively that's important. And local actions are as simple but as kind of boring as writing to your local MP for change, to engaging with your local community, whether I live in Darebin, and it's a very active community here, to learning more about different community, like the climate action justice groups around the world, to just simply looking at our well-being in nature. And there's forest walking groups, all of these. Australians, by and large, engage with these activities already. And the question is, how can we make this a little bit more systematic? I've just recently finished a book that I can't put it up on screen. I don't know if you can see it, but I keep promoting it because I think it's a really good handbook in the absence of a planetary health handbook. And it's called The Good Ancestor. You probably can't see it. It's by Roman Kresnarek. And most of the data from this book comes from the International Intergenerational Solidarity Index, where they've looked at 10 different indicators for intergenerational equity, and also just simple actions that the individual can do. I think, Ruth, you're probably more well placed to answer from a Monash perspective as staff and students, what initiatives are available.
Yeah, sure. Well, if they're Monash staff, I would invite them to, if they're not already, to be participating in our Green Impact program. It's got a whole range of actions that you can take, and of course it does incorporate a lot of health and wellbeing actions that are, not only good for you personally or good for the community, but also good for the environment as well. So yes, Monash is sort of has a lot of resources available to support staff wanting to make improvements in their life towards the planet. So yes, have a look at our campus sustainability webpage for more information about that. I might move on to the next question. Can you provide examples of how legislators in urban planning can assist in implementing some of the planetary health outcomes?
Yeah, thank you to whoever asked that. I actually thought about that during the Professor Gore's talk. I'll just very quickly say that I don't know where you're coming from, whether it's Australia or overseas, but in Australia at least, we can start firstly to look at whether any overarching legislation exists. So in Wales, the Legislation of Future Generations Act exists, so everything will have to lead back there. It's an overarching umbrella piece, which is why it's so important and so interesting based on the Sustainable Development Goals. A number of states are looking at that here in Australia. But in the absence of that, we have the Climate Change Acts, we have also the various environmental health acts, but we also have public health acts and climate and that are increasingly either mentioning the environment or vice versa. And to start with those pieces of legislation where it exists in whatever city you're with, to look at health and to look at environment, sometimes separately, sometimes together. But then I think specifically also to look at the metrics, so air, water, food sources, and to see what guides those legislations. So, for example, in urban planning, as some of you know, in Mount Tamborine, Coca-Cola and other industries had brought out so much of the water that the local school children at some point didn't have local water to be brought in for them to use at school. And when we're legislating to look at underlying aspects of that before starting, I'm not an urban planning legislator, I don't know how it works, but just from a very skeletal perspective, I think looking at the foundations of what makes planetary health important, those moving, housing, feeding, and to go backwards from there. And there are people I can put you in contact with who work on these areas specifically if you want to know more. Thanks.
Great, thanks, Selina. All right, a question for you, Yuming. I'm intrigued by your study of temperature and mortality in China. Why do you think that the optimal temperature for respiratory disease differs between urban and rural areas?
Okay, and thank you, Michael. This is a very interesting question. And yes, they are different of the optimal temperature in rural area and the urban area in Zhejiang province. That is because, the rural area and the urban area people have different behavior and have different working styles. And also their houses have different quality. And also, the most important, I think, is behavior, because the farmers should go outside to work, and maybe they have adapted to the hot temperature, so the minimum mortality temperature is higher than the urban area people, because the urban area population normally working inside, and they have air conditioning, and also in winter there is heater, the central heating system. So it is quite different in rural area and urban area. So this is different.
Okay, thank you. This is a question that I sort of battle with myself, but someone's asked, how much of the burden should be on the individual action versus government policy and corporate action? How do we best combat disinformation, even that coming from politicians, and talk to our friends and family in the best way? Open that to either of you. Yuming, if you want to answer that first. Okay.
How much the burden should be? I think at this moment, because particularly in Australia, because the government is not performing a very positive policy to mitigate climate change or adaptation to climate change. I think the individual action is very important to protect ourselves, because because we have known very high temperature and cold temperature increasing our health risk, so we need to take actions by ourselves. We don't need to wait for the policy or wait for the strategies from the government, because at this moment there is no action from them. But the perfect scenario, that is the government is also taking action. For example, they should develop policies to mitigate climate change and to protect the general population. For example, they need to develop more green space and increase the public water surveys and also other public services. But at this moment, I think individuals should take action and should protect ourselves.
Mm-hmm. Okay, Selina, do you have a response to that?
Yeah, no, I think the only thing to reiterate is that I guess the words of Bob Brown is don't get depressed, get active. It really is, you know, an individual choice. It's our generational choice, which way we move on this. But that these platforms of planetary health, accompanied by so many entities from the UN to WHO, among others, have it's credible science and therefore credible action, and then the systems change will come from that. So it informs legislation and informs, you know, whatever systems we're building, whether it's in terms of financial resources or human resources, or legislative bills that we can act upon. And these things move quite quickly, as we've seen with the children taking action all around the world. And you can see already that the young generation, it really is the problem. I mean, it's affecting them. It will affect them more than us, and they are also the answer. So incorporating in policies wherever you can the voice of the youth and people interested in generations to come is really important, and that includes Indigenous wisdom. That was a roundabout way to answer your question. I'm sorry.
No, that's great. There is a question about Indigenous critics. I'll read that one out. Indigenous critics of the Lancet Planetary Health Commission report note that authoritarian nature of its call for Indigenous community members to be trained and to help protect health and biodiversity. Given the historic role of medicine in co-opting Indigenous knowledges and informants, as well as explicit scientific racism, how does planetary health redress this history and adopt new ways? Selina.
Yeah, I can answer this in part. I think one of the inherent criticisms of anything published in the Lancet or medical journals or places of so-called authority in our current generation is that it excludes people. And for planetary health, this is why I put the slide I did in the way I did, to not have already inherently built the Indigenous wisdom into our thinking and way of being was an omission. And Tony Capon from MSDI actually published on a few book reviews recently that actually mentioned that. And our work on civilization health and our current work is around bringing in not just Indigenous wisdom, but also different cultural wisdom. So from China on eco-civilization, from Latin America, to really address this problematic of exclusion. And to, you know, keep looking at ourselves, in fact, in terms of where our privilege is, in terms of publishing and what we publish and who we publish, but also how to do that. And I think some of the work that I do at the Lancet, because I am still at the Lancet, although I sit also at MSDI, in terms of commissioning, is that increasingly we try to include the groups that we're talking about. So when I published on transgender health, we actually peer reviewed it with transgender community. When we're publishing on planetary health, increasingly we're asking different types of reviewers to look at papers. And I think that's the way forward, especially when we're talking about planetary health. And I would welcome all aspects. If you look at the Healthy Chinese Cities report, we actually included a public aspect, can you imagine, in China, civil society aspect of that commission report, and it was really well taken up. 13,000 people interacted with that. And I think this, you know, society interaction with science is really important. From our history with AIDS, the only way we got anywhere as a movement was by involving the people who were most affected, the patients and people living with AIDS. And it's the same for planetary health. I think we have to have a face. Climate change and health, planetary health, we need faces to be seen, and not just our faces, you know, the intelligentsia that sit in academic institutions. So, yeah, I feel very strongly on that too. So thank you for your question.
Yeah, absolutely. That was great. I realised we're over time. So I might just wrap it up there. So thank you everyone for coming along today, and special thanks to Selina and Yuming for their time and expertise today. I think we've all been able to broaden our horizon and know a little bit more about what planetary health means and what we can all do to improve the planet of our health and our communities. So thank you everyone for attending. If there's specific questions that we didn't get to that you'd like an answer, get in touch with us and we'll get those answered for you. But thank you everyone for coming along today. Have a great day.
Thank you, everyone.
Thank you, Ruth. Thank you, everyone.